So this video is going to be mainly geared toward athletes, but it's really helpful for anyone who's trying to maintain better hydration. So many people have the idea of drinking a gallon of water a day, but without the proper electrolytes, a lot of this water is simply excreted. And if we're not adding in any electrolytes, we could actually make ourselves a little more dehydrated. And the reason for this is because when we urinate, we will lose a small amount of electrolytes. And electrolytes are things like sodium, potassium, magnesium, and calcium. And electrolytes are referred to as solutes. And solutes are extremely important. The body will maintain what's referred to as an osmolality. And this is simply the ratio of solutes to liquid inside of our bloodstream and inside of our cells. So when we increase the amount of solutes, we'll increase the amount of water. And when we decrease the amount of solutes, we'll decrease the amount of water. Which means when we're drinking a lot of water, but we're not actually adding in any of these solutes, we'll simply just urinate out this water in order to maintain the body's osmolality. And at its extreme, osmolality can actually cause edema and high blood pressure. And this is when we have a lot of salt inside the bloodstream, or in between the cells, referred to as the interstitial space. Inside the bloodstream, this high salt will increase our water retention and cause high blood pressure. And if there's a lot of salt in the interstitial space, which once again is the space outside the bloodstream, but surrounding the cells, when the cells are enlarged, they will actually push up against the skin and make our muscles appear a little bit more defined. However, when there's a lot less fluid inside the cell and a lot more surrounding the cell, this will give us that puffy look of being undefined and bloated. So when there's lots of salt in the bloodstream and in the interstitial space, we'll have higher blood pressure and have a slight bit of edema. But not enough salt, and we may get low blood pressure and not be able to send enough blood into important areas like the brain. So we want to find the Goldilocks zone. And it's actually the fluid in the interstitial area that will comprise our sweat. And if we start an exercise session at optimally hydrated, as we sweat, we will become dehydrated, but we will lose both water and all of these electrolytes in the interstitial area. And this is why a great recommendation that I heard from Dr. Andy Galpin is trying to drink back your sweat. Not physically drinking your sweat, but drinking a solution that is very similar to the electrolyte content of sweat. So these are definitely rough estimates, and it actually will change between individuals. However, for every liter of sweat, there's about 1,000 milligrams of sodium and 1,000 milligrams of chloride, which is fantastic because table salt is actually almost a 1-to-1 mix of sodium and chloride. So let's say you lose 500 milligrams of sodium and 500 milligrams of chloride, you could just take in 1,000 milligrams of table salt. Additionally, we'll lose about 300 milligrams of potassium, and then about 10 milligrams of magnesium and between 20 and 40 milligrams of calcium. So the magnesium and calcium can be replenished throughout the entire day simply by the foods that we eat. But it's likely going to be beneficial to rehydrate with sodium chloride and potassium after a workout, or really after anything where you've done a substantial amount of sweating. And this is in 1 liter of sweat. And we lose approximately 0.8 to 1.5 liters of sweat per hour of exercise. But obviously, if you really don't sweat all that much, it might be less. And if you're in a very hot environment and you sweat a ton, it could even be much more than that. And you can actually tell by taking your weight before and after. A liter weighs approximately 1 kilogram or 2.2 pounds. So if you lose about 2 pounds, you'd likely want to rehydrate with about a liter of water. And if you fit into the average that I mentioned, you'd want about 300 milligrams of potassium, about 1,000 milligrams of sodium, and 1,000 milligrams of chloride. And this is given that you entered the session with normal blood pressure and normal hydration. If you entered the session with high blood pressure, then this could actually help lower your blood pressure, and your best bet would simply just be ingesting water with some potassium. But one thing that's important to note is there are people that are more or less salty sweaters. And one great way to know if you're a salty sweater is simply to see if you have a lot of white marks on maybe the brim of your hat or your clothing after you sweat. These marks are actually the salt inside of your sweat, and if there's a lot of white marks, then you're likely a salty sweater. And at this point, you may want to ingest a little bit more salt. But the best way to find out how many electrolytes you personally lose in sweat would actually be to get a sweat test. But if that's not available to you, you can use this marker as a proxy of how much salt is in your sweat. Additionally, if your sweat tastes salty or stings your eyes when it gets into your eyes, you're likely a very salty sweater. So depending on the amount you sweat will depend on how much water you'll intake, and depending on whether or not you perceive yourself as a salty or non-salty sweater, can help you dictate how much salt you add to your rehydration solution. And I will come back to the fact that if you're exercising to maybe try and reduce blood pressure or even reduce bloating after a night out, then actually just rehydrating with normal water and maybe some potassium could help get a little bit of excess salt that you retained or are retaining out of your system. And now the last thing I'll mention is that it's not always the best to just chug a liter of water. And this is simply because it appears that the body is much better at absorbing and utilizing smaller doses of water more frequently. Simply, it's better for rehydration and absorption. So if you chug a liter of water, it's likely going to pass right through you. And if you're drinking a solution that is as salty as I mentioned, this will likely actually cause some stomach upset if you're taking in grams of salt at one time. And this could leave the salt inside your intestines, where again water will flow, but a lot of salt and water in the intestines will simply just be excreted in the urine and feces. So you'd want to slowly drink this at a rate that will allow for maximal absorption, which is why I recommend to athletes to actually know before the game the content of their sweat and have an estimate of how much they're going to sweat in that game given the temperature and how much they normally sweat. And have a solution ready that you can drink throughout the game to maintain hydration the entire time. And while it may not actually pan out, your goal in your mind is actually to be just as, if not more, hydrated when the game ends as when it started. And this will certainly allow you to maintain performance throughout the entire game, and make it much less likely that you'll have any sort of recovery debt thereafter. And the last thing I'll mention is that we can get hydration from our food as well. And one great way to get both potassium and hydration is simply eating fruits. Fruits are made up of 80 to 90% water, and they also contain a ton of potassium. So if when you end the game, maybe you're a little bit dehydrated, a great post-meal game would be some fruit, specifically oranges and bananas, and maybe a nice piece of steak with some salt on it. With that being said, there's a ton more I could talk about, but I really don't want to waste too much of your time. So thank you for listening, and I hope I have the pleasure of speaking to you next video.